They say a journey of 1,000 miles starts with a single step. Same thing is true about jumping in the water if you're using a diving board. It just takes that one step and, well, you're gonna hit the water. The question is then, what do you do when you hit the water? Or what do you do if you're walking that 1,000-mile journey and you discover you're on mile 8? It's a little intimidating to think about all those steps that come afterwards. There's excitement at starting something and a sense of accomplishment and a plan, but sometimes it's not so clear what is supposed to happen next. It's Dwight Hurst here. It's the Waismann Method podcast. And Clare Waismann and I are going to be addressing that exact topic today when it comes to sobriety and treatment from opioid dependence. You can apply this to all kinds of addictive and compulsive things, though. Starting in and of itself is a huge task. We were able to talk about that a couple weeks ago when we talked about how complicated it is medically and emotionally and psychologically, even to take the first steps of getting sober and just stopping using and getting into treatment. This is one of the most fun and passionate discussions that we've had on the podcast so far. Oh, I was really grateful for all those of you who reached out over social media and shared some questions. We had some of those come up in our discussion, and I've struggled to make sure that I wrote my notes down correctly and got your names right, got your names associated with the correct question. Unfortunately, we weren't able to address every single question in this episode, but that's great because many of your questions actually fit some of the topics that are coming up that we're going to be discussing about some of the definitions of treatment and what we're looking for, particularly when you're going through the detoxification part of treatment. But then, as you've already found out, we talk a lot about wellness and counseling and a real well-rounded approach. And that's what we're going to get into today.
How are you?
I'm doing great. Yeah, Marina told me it was a patient, or,
Yes.
That's pretty important. We're going to do that.
It is. So what are we talking about today?
Talking about Postgame. Post-care after coming out of the detox, right?
Of course.
Yeah.
Of course. Let's do it.
So, we talked before about somebody walks into the clinic, they go through this detox process, we talked to the doc and all of that. Now, let's say somebody is through that process, they've done the medical detox, where do they walk next?
I think the best solutions are found based on the best assessments. So it is very, very difficult to direct somebody in a sober path or recovery path, whatever you like to call. For me, is more like a healthy path. If you have not had a thorough assessment of patients, health issues, including physical and emotional issues. There are patients that after the medically assisted detox, they need to follow with your pain doctors because they do have chronic pain. There are patients that more often than not have misdiagnosed emotional issues or undiagnosed emotional issues like anxiety, depression, even other mental health issues that are more severe.
And a lot of those emerge after getting free of a substance. A lot of those do rise to the surface and are more accurate. They're more accurate diagnoses.
Of course. Correct. So it's very hard to make an accurate diagnosis when you are using a numbing device because emotionally you're not present enough to have that accuracy you need in order to, decide what path to go.
When I've known people who are on opiates or methamphetamines too, I've seen where they'll get a diagnosis of personality disorder or bipolar. And sometimes those are accurate, and sometimes you find out when they're chemically stabilized, it's not accurate at all. That some of the mood swings and the behaviors are exacerbated or triggered by the drug use.
Correct. But I think this is not just of substance abuse. This is with any physiological condition. If I use a substance that, would speed my heart rate and go to a cardiologist, if he does an EKG, he's probably going to think I'm having a heart attack. The same as blood pressure. If I jog, or get very anxious as I'm arriving to the doctor and he checks my blood pressure, it's going to be high up there. So you can't make a proper emotional diagnosis on a patient that is emotionally, influenced by the substance they're using.
It's interesting because as I put out the question online, a lot of the questions people had revolved around using counseling and other diagnosis and things in the treatment. And I had to chuckle when I read that because I knew why they were asking is because some of the reputations that detox facilities have. But I also chuckled because I knew what you would say. I know that you're very much plugged into that, getting accurate psychological evaluations and heavily recommending, if not even enrolling, into counseling as part of their health management.
Of course, especially if you, come from the point that, substance abuse is not the issue, but the consequence of, mostly emotional conditions that were not treated. So that is so incredibly important. Like when patients say, what is your success rate in a year? I just got that question like an hour ago. Saying we give you the opportunity to be emotionally present so you can get the treatment you needed in first place before you start using drugs.
And that's an interesting thing because there were a couple people. I know that Erica was one of them who made this question. There was someone named Lewis who also brought this up, which the question comes up of what are the long-term results. And then I think someone else nailed this question. I don't have their name right here, which I think is the first thing to answer, which is what is the definition of success when it comes to detox? Because I think detox is a step in a greater treatment process.
Correct.
It was one of the things I've learned
Correct.
from you. And so you have to define that, like what are we looking for? If someone says the long-term effects of detox, I guess what they're saying is does it help people as they go through health management and sobriety? Does it give them a leg up that is significant, and how do we know that? I guess is what they're really asking.
Well, again, detox is a necessary part of anybody's treatment of substance abuse in order to get healthy, period. So, medical detox, I think it should be available for everybody, period. Let me give you, Dwight, an example. So this week we received this patient around 40 years of age, okay, using opioids with zero symptoms. He had pneumonia on both lungs.
Wow.
Exactly. And not, severe pneumonia in both lungs. If this is a patient that went to detox in a rehab, he would not have made it. His oxygen level was already low. So he's been in the hospital with us 4 or 5 days. Not just getting detox slowly, but taking care of his pneumonia that he wasn't even aware. He was tested, obviously, for COVID, and thank God he is negative for COVID.
Yeah, but that's something that needs to be stabilized first, right? The pneumonia would have to be stabilized before you could safely do a detox.
Correct, but my point here is opiates numb a number of different conditions, physical and emotional conditions. So unless you treat and assess those conditions, so the physical condition we are able to treat in the hospital. So, we thank God we work in a full service accredited hospital where we have a number of specialists. So, pulmonologists come, they're able to treat his medical issues over there while Dr. Lowenstein can work with his, opioid dependence. But mental health issues, sadly enough, is not something that we can treat in 3 days, a week, 30 days, 60 days, or 90 days.
Well, it depends what you're looking for. One of the things I run into is the same thing with inpatient psychiatric treatment often is you go into that and there's a danger that if people don't know what they're shooting for, they might come out thinking that nothing's been done, when in reality it's simply make sure you don't kill yourself, stabilize, get some med recommendations, and make sure you have a therapy plan. If you get those things, if you get those things from an inpatient hospitalization, that's goal met. And so there has to be more after.
The issue is not solved. So you have your right foot forward to start reaching a healthy state, right? So you got your meds. Now you're going to start therapy, finding ways to cope with issues. Hopefully the meds will stabilize your mood, and make you able, to wake up in the morning to fight for your health. So it's a combination. I mean, we are, as human beings, we are complex. We have a brain, we have a heart, we have a lung, so there's so many organs trying to work at the same time. You can't expect to go to one specialist and have everything fixed. And I think that's what people expect of rehabs.
And I think it's good to be aware of that, because it sounds like one of the mistakes people could make is going through a detox procedure and thinking that they have arrived at some kind of a stable location that isn't just, it's a stepping stone. When we talked to Dr. Lowenstein, one of the things I found very interesting was how nuanced even just the safe medical detox procedure can be. So the first step is complicated. And then we're talking about, now we've gotten through that, we're going to these next steps. And it sounds like you're saying one of the big risks is that we don't think about the next steps. If someone just goes through that. And there's a lot of programs out there that just offer, some clinics, or they just do a detox, and then it's like, okay, you got it out of your system.
I don't think some. I think it's most. I think most people, programs out there promise, especially family, loved ones. Oh, yes, he will come here and we're going to work with him in his emotional issues, in his attitude, in his honesty, with his chemical imbalance. Yes, we have a psychiatrist, we have a doctor, we have meetings, and they promise the family, send your kid here for 30 days, 60 days, and we'll send you a brand new, perfect human being. It's a lose-lose situation for everybody involved.
Yeah, I mean, I chuckle,
there is
but
no such thing.
I chuckle just because of seeing it so much, but it really is a sad thing to invest in, because I think there is a real danger there. And when someone has detox, they are in more danger of overdose too, aren't they? I mean, right away, their system can't take what they used to use.
Yes, I agree with you. But this is, actually something that is constantly brought up with medically assisted detox. Well, but afterwards they are at a bigger risk of overdosing, of course, because they've been detoxed. So not to risk them overdosing, should we just not detox them and let them stay on opioids forever?
Right.
Because that's the thought of Suboxone, Sublocade, all the buprenorphine drugs. Is, if they are taking opioids, they are at less risk of relapsing. Of course, they can't relapse. They never got off opioids.
Yeah, that brings up an interesting question that some people put out there. We had listeners Sarah and also Lewis. We're both two people who put forth this question about what is the attitude or feelings that you have about drugs that are intended to cut down on cravings. Because I know Dr. Lowenstein said that he is in favor of some of those types of things, but then I think also we think of, as you put it, Suboxone and some of those drugs that are actually there to treat withdrawal as an alternative to detox. So I guess it depends what kind of meds we're talking about.
Again, they're not there to treat withdrawal. They are substitute drugs, where if you take them, you don't withdraw because you're still taking the drug. Again, same idea as if, you came to me because you're drinking, a liter of whiskey today, so I'm going to give you vodka instead. Of course you're not going to withdraw. You're still taking opioids. Oh, you're still drinking alcohol. So yes, you're off your whiskey, but you're still on alcohol. Now, what is my thoughts about it is there is not one solution for everybody. There are people that for one reason or another and those are very few, they are not ready to come off opioids. Their reality, is not one that they can be without a numbing device. Maybe they could if they had all the emotional support and social support and financial support that one needs. But that, sadly enough, is not the case of all society.
From our conversations, one thing I've really picked up is this individualization that comes up in every one of our topics, really. Like you say, there's the overall feeling and the feeling that that's definitely less patients who are going to benefit from that, as you put it, but also not having a closed mind is also very important, it seems like.
I have zero closed mind. I am, I believe that whatever gives you the best quality of life is the path you should take. Other than the path that you're taking this year, maybe it's going to be a different one next year. But I think options should be available. Doctor supervision should not be a rarity. It should be accessible for anybody that needs it. Period.
There was one comment that someone made about that of how often price can be something that makes it very difficult. There was one question I really felt for the asker that was posted and said, wow, if I'm not wealthy enough, how do I help my family? And I thought, just really, you feel that.
I hear that. We have tried to bring the costs as low as possible without compromising the quality of the services we offer. But with that said, there is no insurance coverage. I'm trying to get the insurance coverage right now for the recovery center so we can lower a bit of the cost. But again, insurance are still covering drug treatment as behavioral health.
It's very, very complicated with that kind of stuff. It goes back to the whole medical system. I have been amazed at how many treatments are getting some really good research around them and are being turned down by insurance companies a lot of times. And sometimes it just has to do with whether or not it's backed or whatever. So that's an ongoing battle that you mentioned, is trying to get a detoxification and insurance working together.
It's you go back to drug treatment. Drug treatments are still being controlled by counselors, social workers.
And I would add the legal system. A lot of times,
the legal
picks
system,
up the slack.
and not by medical science. So, Dwight, now you asked about drugs to control cravings. We use naltrexone and Vivitrol. Okay.
Mm-hmm.
Those are antagonists that have zero opioids in it. They're not opiates. They do not cause withdrawal. They do not cause dependence. None of the above. The only thing is those medications can only be taken when you're opioid free. So you have to be completely detoxed in order to use those medications. And they are wonderful medications to control physical craving. Okay. We've been using this for over 20 years. And the biggest issue that we had in the beginning, one of the reasons we created Domus, is nobody would allow a patient to take naltrexone in a treatment center.
Oh,
it would not be considered in recovery.
Wow.
And we used to fight with them and say, please, our patient got detox. He's going to your treatment center. Please allow him to have the naltrexone. He's a non-narcotic. He's non-mood altering. He's non-addictive. No drugs. The same thing with antidepressants. No, they cannot take any mood altering medication.
That was something that blew me away when I first learned it, that antidepressants were considered to be mood altering in a sense that there was shame and discouragement around that, which is treatment, actually.
So this is what I'm saying to you. So we've been fighting because we have been offering, for nearly a quarter of a century, a medical solution for opioid dependence. We have been, criticized because it's not the medical community that is researching us and deciding if this is good or not. is the recovery community, people that do not understand the physiology of dependence.
Yeah, we had a respondent to one of the questions who works in some rehab and has witnessed detox processes, and that was one of her first questions was, what kind of qualifications? And you're talking about like medically trained, obviously doctors and nurses, and unfortunately that's not always the case that you find in a lot of programs.
In most places it's not. People have seizures in rehab centers. They die from dehydration, from vomiting and diarrhea. We, as I told you, this 40-year-old that we treated this week, he would not have made it for a week detoxing from opioids.
Wow. And it's scary when you think about it.
Like, exactly. No, we see patients with severe issues of hypertension. 50, 60-year-old men that take 2 different blood pressure medications. Once we remove the opioids, sometimes it's hard to control their blood pressures because, it's now you remove the opioids and they have to readjust.
Yeah. So
who is checking all this in a rehab?
One of the things that it sounds to me that's very important is not only there's the counseling side for the psychological health, and then there's also getting whatever check-ins, whether you're in a wrap-around medical program like yours, or even if the only resource is their doctor, getting some general physiological checkups would be very important after detox, it sounds like.
It sounds like what I'm trying to say is detoxification, okay, is a physiological event that needs to be managed by physicians, period. Whatever emotional care, recovery care, support, peer support you decide to follow after is a different story altogether. Some patients can do well by doing individualized psychotherapy and maybe a psychiatrist. Some people, their environment is so tainted, they do need to be, in a treatment center where, they are at a safer environment. I wouldn't even say safe, but say safer. But again, it's the physical issue and the emotional issues, they are different issues, but they're always connected because we are one. Our heads stuck to our bodies.
Now,
but you cannot promise somebody that you're going to be with me 30 days, 60 days, or whatever, 6 months, and I'm going to fix all of your life.
Yeah. No, that's a big part is that it's an ongoing health management. I really like how you refer to that oftentimes as health management, health building, rather than just focusing only on the sobriety. I think that
correct.
Abstaining from alcohol or opiates, or many people who have not fought with addiction or struggle with it on their own, and unfortunately many who do struggle with it, are under that impression that if I can get the substance out of my body and don't ingest it anymore, that's it. Everything should be great. And that's only a small part of really living a healthy life. It's a low bar for health. Yeah.
Of course.
One of the issues that was brought up it was the same respondent to our questions who works in a related industry. Her name's Callie. Mm-hmm. She mentioned having worked in some facilities where they would see actual involuntary admissions that would come in, and the question of what, how does waking up after going through an involuntary detox program affect kind of the outcome of how successful someone's likely to be. Now, your Waismann method always works with voluntary admissions, I believe.
Correct. So we won't take any patients, they're mandated by court or that really do not want to be here. Because we are not a lock facility, we are not a psychiatric facility, and it's usually a lose-lose situation, so we don't work with involuntary patients. Although I think that sometimes, their bottom has gone to such a low place that they need to almost be, resuscitated from where they are.
It is an interesting process, having seen some people go through that. And I'll say I've seen some people who have done well going through that process. But in general, there's a lot of disadvantages to not being at that point, to involuntarily being pushed into treatment.
Correct.
I feel like.
Correct. And again, it is what treatment is what treatment they receive. I have seen patients that just gave up because they believe they have failed so many times that they are not willing to go through all the emotional and physical suffering to fail again, where most of the time they didn't fail. The treatment center failed them because they did not receive treatment based on their needs. They receive treatment based on a preset protocol.
Yeah, meeting the program's needs instead of the program trying to meet their needs. Yeah, the reverse.
Correct. That's the difference of treating the patient and treating addiction. When you focus on addiction, often the patient becomes unseen. So when he leaves over there, he leaves actually more depressed and more hopeless than he did when he came in. Supposedly, he got the treatment that everybody said is what he needed, and he still leaves there wanting to use drugs. And the reason most of the time he wants to use drugs is because the emotional health of that patient was not properly assessed, and he did not receive the emotional help he needed.
And then the proper aftercare plan is important too, and you can't do that without that assessment. I'm realizing how key that really is.
Correct. So when they say to me, well, but they were at Domus, for such a small amount of time. Yes, they were at Domus for a very, very small amount of time because we are not a long-term rehab. But with that said, I think, Dwight, and I can't say for all patients, but I can say for most patients we see there, once we medically detox them, okay, where they don't have to hug a toilet or, for days on end. So once they're medically detoxed and they come into the hospital as they would come in for any other medical issue, they are received as a patient, not as a drug addict. They are physically well taken care of. They are respected as individuals, and then they go to Domus. What do I try to do at Domus? Domus is a 6,000 square feet home with 6 suites. I try to have everyday baking goods, so the smells are good. I try to have the home with lavender smells. I try to have them in the sun. Try to show them that every hour they will feel better, regardless of where they started from. By the time they leave, they know they can feel good without drugs, even if they relapse, even if, things don't work out when they get home.
Yeah.
Give them hope.
Yeah. That's a powerful message of hope to really look at what are some of the things that you can enjoy and feel good in a life that is without drugs.
So let's say after a month or 2 months, they start craving again. They feel they're going to relapse. They can call and they can come back for 3 days, 5 days, 7 days. They don't need to relapse to come back, but sometimes you just need a little more, support when you get home or after a month. Also, you found out the things that triggers you. I found out that every time I go visit my parents, I get extremely anxious. By the time I leave there, I can't sleep. I think I'm using drugs. So they come for Domus for a week. They, sit with the therapist, David, that we spoke to, one-on-one, no groups, and they talk about that. What happens when you get to your parents? What are the things you're concerned of? Again, trying to assess what are the triggers and going from there.
You guys don't do the group therapy?
We don't. We don't. Yes and no. So
Sounds like
David
there's some
does
feelings
individual
there.
therapy only. Okay?
Okay.
First, because patients are at very different places when they come to Domus. You have patients that got treated on Monday. You have patients that got treated on Friday. So physically, they feel very differently. And we have a very short window with them. And we really want to get to know them, you know, as much as we can, so David can work whatever path of emotional health, you know.
So there's an issue of budgeting for time and making it practically effective for them.
It is not just time. Once you remove all the opioids or alcohol from somebody, they are raw. You know, there's no blanket between them and reality. It's hard enough for them to deal with their own issues. If they have to hear everybody's war stories and issues, it can become overwhelming.
And that is one thing that can happen in a group, is it can deteriorate into that different ways.
That's what I'm saying to you.
Different experiences that can war story.
Exactly. And because we have very, very few patients at one time, we try to individualize their treatment as much as possible. So like a patient that has severe sleeping issues, if they sleep until 10 in the morning, God bless them, nobody's going to wake them up.
Okay.
You know what I'm saying? But if a patient, a young person is sleeping all day, I want them to be woken up. I want, them to go for a walk, play some basketball, do something. So every patient is different. Again, we treat patients 22 years old and a patient 82 years old.
Yeah. When they leave that program, the Domus After program, what kind of recommendations, I'm sure this is very individualized, but in general, do they go out with recommendations as far as you ought to make sure that you're talking to your doctor, you ought to have some kind of a therapist,
Correct.
You ought to have those types of things?
Correct. So if we in the hospital find something, okay, their sugar's too high, and we saw something in the EKG, like this patient this week, he will have to follow with his physician because, there is pulmonary issues. Then Dr. Lowenstein, will speak to them to speak to their doctors if they need or want. Dr. Lowenstein can speak to their doctors and explain more what we found. Emotionally, David and them will discuss what's the best foot forward. Not just what David believes, but something that will fit with their lives and they accept. I mean, sometimes you can be blue in the face to say what you should do and they won't do it.
And I like that because you're getting their buy-in. It also strikes me as a way of showing respect to the person to manage their own health.
Now, David will speak to them for the first 2-3 weeks when they get home, just to make sure that they are, establishing well and they're following through whatever they need to keep. And that's what we talked about the other day. We all have to work for our health daily, regardless if you had a substance abuse issue, a high sugar issue, or obesity issues, whatever it is. We all need to fight for our health. And that's the goal. So there is no preset protocol for detox. There is no preset protocol for emotional care.
Well, I can't think of anything we could possibly add to that, so we're going to go ahead and call it there. Thanks so much to all of you who submitted questions. If you have questions that you'd like to include, we would love to have them. The whole point of this whole podcast really is to increase information, education, and help people to be able to make good decisions about how to deal with opiate dependence and anything that you may be dealing with. And those questions are very important. You can hit us up on Twitter @opiates, or you can email us at info@opiates.com. As always, if you'd like to learn more about the Waismann method and our approach to detox and treatment, you can go to the website opiates.com. As simple as that. This podcast is a production of the Waismann Method Treatment Center. Our music is the song Medical by Clean Mind Sounds. And for Clare Waismann and myself, thanks so much for listening. We'll talk to you again soon.